This is the ultrasound study of case of infertility. Married 8 years. She has been visiting a lady health visitor in her area. This is the urinary bladder, and the lady doctor has been using some medicine intravaginally, and now she has come with this severe pain in the pelvic region after visiting the lady doctor. Now we see that the uterus measures approximately I will try to rely on the anterior-posterior diameter because the uterus is elevated. So this should be between 2.5 and 5 centimeters. So this dimension measures 2.9. So the uterus is normal in dimension. This slit-like area that you are seeing in a longitudinal section of the uterus is the endometrial canal, and this is the anterior myometrium, the fundal region, the posterior wall, the cervix, the vagina, and this is the urinary bladder. This is the longitudinal section of the uterus. Now here below, posterior to it, what you see is in fact, what is this structure? Will confuse you at present. This is the transverse section, and in transverse section this is the right ovary. This is the right ovary, measuring 3.5 by 2.5. This is the uterus in transverse section, and this is a collection in the region of the left adnexal. Okay, now this is the urinary bladder in longitudinal section. This is the transverse section of the uterus. This is the endometrial canal. This is the ovary. You can see the follicular activity in this ovary, and this is the right ovary. This area is that of the right ovary, and these are the tiny follicles, developing follicles in this ovary. Whereas this is the cystic area full of internal echoes, which is on the left side. Now on the left side you can see there is a multiloculated thick wall collection of fluid with internal echoes, with spine septas. Now here you can see the three structures together. This is the ovary, this is the uterus, the endometrial canal, and this is the tubo-ovarian mass of infective nature, an abscess possibly because of the nature of the fluid content within it. This is the fluid and the debris, internal echoes that are seen within it that are of different strength. Now let's focus on this area. This is the tube. This is the left tube, fallopian tube, and this is a cystic area full of internal echoes, thick internal echoes with a small amount of fluid within it, and no calcification is seen in it, no solid element is seen. This is the uterus, this is the endometrial canal in transverse section, this is again the ovary. So this is a case of left tubo-ovarian cystic mass, a Pyosalpinx rather. So this is a case of Pyosalpinx with tube dilated up to 7.4 by 4.3 centimeter. This is Pyosalpinx. This is the urinary bladder. This is the uterus. This area is the uterus in transfer section. And this is the right ovary. This is the ovary. Right. So this is a case of left Pyosalpinx. Now what important information that we can give to this patient is that if this tube is removed surgically as has been badly damaged by the collection of material that is an abscess. You can see fine, thin XY septa, these septa, fine septations, thick echoes, low-level echoes. So if she gets rid of this tube, the left tube, the right ovary being normal and with normal follicular activity, she can be able to be fertile if her left. Otherwise, there is a potential that this infection may not travel to this site as well. This is the developing follicle in this cycle. This one, 12.3 millimeters. This is the ovary. This one. These are the tiny follicles. So we have to save this ovary. This is a case of Pyosalpinx. Left side. Thank you.